Hi, and welcome to this prenatal yoga class for morning sickness. Now, morning sickness or just pregnancy yoga, as it can go on all day long, is something many women have to cope with, especially during their first trimester with the hormonal changes. So, it's nothing abnormal, but it's often a sign of healthy pregnancy. Nevertheless, it can be very challenging and difficult to cope with, especially since there's no magic cure that works for all, nor is there one specific yoga posture that can make it disappear instantly. However, you can try a few dietary changes and lifestyle changes that can help you ease it down, as well as a nice and gentle restorative yoga practice, which will give your body space and time to rest, and as well a more positive mindset to get through this. So today's sequence is especially designed for that. We'll just do a few gentle poses with lots of deep breathing, few gentle stretches, which are all safe for your first trimester. And just in case you have any doubts, make sure to read the safety guidelines below or check in with your doctor. So let's get started with one of my favorite resting poses during my pregnancy, which is going to be the reclined butterfly. So all you need is a couple of pillows or bolsters so you can keep your head and heart elevated. And then we're going to place the base of the spine in front of the bolsters. And then from there, gently start laying down. You can stretch the back of the neck. And you can scoop up the tailbone so you create a bit of length in the lower back. And then from there, you're going to place the soles of the feet together so the thighs can drop outward. And then here, you can stay like this, or if there's too much tension in between the thighs, you can place two blocks or two pillows underneath the thighs for a bit of extra support. And then once you're comfortable here, you can either keep the hands beside the body or you can place them on your belly, connecting with baby. And then should this pose still be uncomfortable, you feel too much tension in between the thighs, you can always stretch out your legs and then even place a pillow behind the knee pads. So wherever you are, just make sure you're comfortable. And then we're going to start to take a moment to just connect with our body, sliding the awareness from the feet through the legs, feeling the release of the spine into the bolster. So we're creating this nice soft back bend here. At the same time creating space for belly, for our digestive organs, heart center, releasing the back of the neck, the facial muscles, all the way up till the crown of the head. Relaxing the body. And then from there, turning the awareness onto the breath and just breathing in and out through the nose to start. And then coming to a nice and deep, what we call abdominal breath. So you want to take a deep inhale through the nose, sending the breath all the way down into the belly, feeling the belly rise with the inhale, and then relax again with the exhale. Taking nice deep breaths here. And deep breathing is a very effective technique for nausea. And it would also help sometimes is having a bit of essential peppermint oil nearby. So you can rub a bit on your hands, take a few deep breaths in the palm of the hands, and then just connect with this nice deep abdominal breath for a few more rounds. So inhaling through the nose, letting the belly rise, and then exhaling through the nose. Or if you feel any tension, you can also exhale through the mouth and just sighing it out. Another option here. Inhaling through the nose, and then exhaling through the nose, or just sighing it out through the mouth. You can stay here as long as it's needed. This will help you relax, help you ease down these unpleasant sensations. Just working with the breath. And coming to one last deep inhalation, one long exhalation. And from there, you want to gently start bringing the thighs back together, walking the feet outwards, letting the knee drop inwards. Just release any tension you might hold in between the inner thighs. And gently opening those hips here. Very beneficial to prepare for pregnancy and labor. And from there, you can stretch out your legs. Inhale, lifting the arms overhead, and then just warming up the joints, the wrists, the feet, a few circles to one side, towards the other side. And stretch through the fingers, flexing the feet, squeezing fists, pointing the toes. And from there, bring the arms back beside the body, gently stepping the feet flat on the mat, just rolling onto the left side, and then gauging here, coming to sit. So we're preparing for a little counter posture. So from here, we want to come into child posture, and we're going to do a supportive child posture. So we have space for belly, so you can stack 1 or 2 pillows under your forehead or under your chest, and then you want to keep those knees nice and wide, so you have space for belly. You can do the same thing by supporting yourself on your forearms, so you get that chest nice and open and there's no suppression whatsoever. And you can just focus again on that nice deep abdominal breath. At the same time, you get a nice stretch along the spine, again a gentle opening for the hips. So just deep breathing here. If your head is turned to one side on the pillow, you can gently turn it to the other side. Again, making sure you're comfortable here, no strain whatsoever, just releasing yourself into the pose. Nice deep breaths into the belly, breathing out any tension, any worries you might hold on to, releasing your nausea. Nice deep breaths for a few more rounds. Coming to one last deep breath here. And then from there, we're gently going to walk our hands up, knees back together. And then you want to come to a seated position. So either you can sit on top of the bolster, coming to a seated adherent position, which is very good for digestion. Or if your knees were sensible like mine today, you can also come to a cross-legged position and then just elevate your hips on top of a bolster. And then from there, we're going to take a deep inhale, lifting the arms overhead, interlacing the hands, flipping the palms up. And then with the exhale, flowing to the left side, stretching the right side, inhaling, flowing to center, exhale, opposite side. And then you just swing from left to right with your breath. So just creating a bit of opening for the side body, some length along the spine. And then we flow to the left side. You can drop your left arm beside you, keeping that right arm overhead. Breathing here into the right side, inhaling to center, and then also holding the opposite side. So just a few gentle stretches here, which will help us again to create space for the belly, for all those changes in the body. Inhaling again, flowing the arms up, and then interlacing the hands behind the back and just opening the chest here, stretching out the chin. And then again, nice deep breaths here, down into the belly. And again, one last breath. And releasing here. Now we're going to finish with a nice restorative hip opener. So you spread your legs nice and wide. If your spine and rounding, you can sit on top of a bolster. And if there's space, you can also lean forward. And then again, you can use the support of pillows or bolsters so you can keep your spine nice and lengthened. And then you want to go as deep as you feel comfortable here. So be very mindful with this opening, especially because we're going to stay a little bit longer. And during pregnancy, you get more flexible. So don't overstretch. Find what works for you. Make sure you keep your heart, your head elevated. You can gently flex your feet to get a bit more stretch in the back of the legs. And then once you find that pose, try to sit still. And again, focus on nice deep breaths down into the belly. Exhale as you're breathing it all out. Enjoying that sweet release. At the same time, enjoying the opening of the hips, the space we are creating for the upper body to breathe freely. And then, as you stay in the posture a little while longer, try to stay present, focusing on the body, on the breath. And taking one last deep inhalation all the way down into the hips. And one long exhalation. And then gently coming out. You can walk the feet flat on the mat and then just windshield wipe your knees from left to right, releasing any tension you might have created in between the thighs. And then from there, we're getting ready for a final relaxation. I'm just grabbing two pillows again, laying on my left side, supporting my head, one pillow in between the legs. Just make sure you're comfortable here. Your hand can be on your belly, resting beside it. The idea is just to get comfortable here and lay still for a minimum of 1 to 5 up to 10 minutes. The time you have to rest, release, recharge, and just absorb the effects of today's practice. While you're laying here, you can scan your body from your feet till the crown of the head. You can also scan your heart, scan your mind, just absorbing any thoughts, any feelings just passing by. Just enjoying to lay here, being present and at peace. I'm going to leave you here. I hope this practice has helped you to ease down your morning sickness. And if you want some more dietary and lifestyle tips, you can check out the corresponding blog article below. And then I'm thanking you for practicing with me today. Namaste.